Do you feel joint pains very frequently during the morning hours? Do you feel joint pains which are changing in positions? Do you feel joint pains which are frequently changing? Like today, they are over your knees, and tomorrow, they are over your shoulders. Or do you have joint pains which are severe in the morning and turns down to nil by the noon? If yes, this is a video for you. I am Dr. Jai Mehta, a consultant physician, diabetologist, and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. So yes, we are talking about rheumatoid arthritis. So what is rheumatoid arthritis? Now this is basically a autoimmune condition where your haywired immune system considers your self cells as foreign cells and starts attacking them, and this is why you have the array of symptoms that presents itself in form of rheumatoid arthritis. And all this creates a specific type of joint inflammation, and it damages your joints, and that creates the specific pattern of pain that occurs in the patients of rheumatoid arthritis. Rheumatoid arthritis may involve any joints of your body, but it primarily involves your mid and small size joints, and the patient classically gets up with a severe joint pains over their fingers specifically, and this pain gets nil by the noon without taking any medications. Now this is the symptoms that I'm talking about, the early stages. Now this pain signifies that there is an ongoing inflammation over the joints, and this inflammation causes damage to the joints. But it is important to note that if this pain or this dysfunction continues for longer periods, it may cause a permanent joint damage which is irreversible. So it is very important to get the treatment for this condition, and more important is that you get the diagnosis of this condition at the earliest so that the treatment can start. Now usually the diagnosis is based on the clinical symptoms almost always. That involves the morning stiffness of joints, followed by generalized uneasiness, loss of appetite, loss of weight, and easy fatigability. Also, there are some blood tests also that can signify this condition, like R factor, ESR, CRP, and also certain types of X-rays can significantly judge the condition very prematurely. Now, why it is important to pick this condition at the earliest? This is because it has got very severe late stage complications. Now, these complications can not only involve your joints, but it can also involve your lungs, heart, kidneys, and even your spine. And once the late stage complications starts, those complications are irreversible. So for example, if it involves your lungs, and if a lung damage has started, you can always slow down the progression of the lung damage, but the damage that has been already done is irreversible. So it's always advisable to get a consultation of your doctor as soon as possible if you have any of these symptoms that I recently mentioned, and get the treatment started. Also, it is very important that you don't rely upon the over-the-counter medications for pain. They are basically painkiller medications, and they are highly unindicated in rheumatoid arthritis because it is a long-term condition, and painkillers will not be getting you the results you want. I had one of my patients who was a 38-year-old female who presented with a kidney dysfunction and high blood pressure which was never below 160 by 100 millimeter of mercury. Now, on taking a detailed history, I came to know that she was taking over-the-counter painkiller medications for around 2 to 2.5 years because she was having these type of joint pains since at least 3 years. Now, after consuming these medications for this long duration, her kidney started firing up, and that caused her creat levels to rise above 5 and her blood pressure levels above 160 by 100. Now, we can always start supportive medications to bring down her blood pressure and all other conditions, but it is very important to note that the kidney damage that was done was permanent and progressive. That means 5 years down the line, she will be dependent on dialysis, and by the next 5 years, she'll be requiring a kidney transplant. And if she doesn't receive a kidney transplant, she'll not be able to live longer. So a life beyond 50 years is also tough for this patient. Presently, she is only 38. So just imagine a pill taken for 2 years without consulting your doctor, without knowing its side effects or without knowing its impact, can cause such a huge damage. So it is always good to go early for such cases, keeping your doctor always. I am Dr. Jai Mehta, a consultant physician, diabetologist, and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.